Talking about the bipolar affective disorders, how do you basically diagnose? You have taken the history of the person and you have diagnosed, you have to come to a conclusion after taking the history and after taking the parallel history that the person is suffering from some kind of a mood disorder. Obviously, you will basically encircle the depressive episode, and the ICD classification will be kept in mind. Of course, the International Classification of Diseases, which gives you a definition of depression as a state in which you have anergia and you have anhedonia. Anergia is basically a decrease in the energy level, and anhedonia is a decrease in the pleasurable activities, and basically the mood is in an unstable kind of a condition. So after this phase of depression, after this phase of pessimism that the person is suffering from, he will go into a phase of mania or hypomania depending upon the severity of the symptoms. And the state or the episode of mania is basically regarded as when you have an elated mood, when there is basically a speech slur that is noted down when you're taking the history. There is a flight of thoughts that is noted down. There is a hyperactivity phase. The person will give you a history that he's suffering from a phase of insomnia. All of these features collectively will give you a diagnosis that he has basically that bipolar mood disorder that you are basically focusing on over here. After this diagnosis, this clinical diagnosis that you have made, especially on the basis of history taking and working as a practicing psychiatrist, you should know that history is the mainstay when you diagnose cases in psychiatry. So psychiatry is a field where history is very important, and you should take a complete history from the patient as well, and as well from the friends and the family to diagnose a particular psychiatric case. All of these symptoms, what are the clinical features? We have already discussed them. And in the third section, in this section, we'll be discussing the course and the outcome after the diagnosis has been made. Then the assessment is very important, depending upon the severity of the symptoms, of course. There are a lot of classifications that are internationally recognized. And how do you basically classify if a person is suffering from the mild, moderate, or severe form of the disease? Because upon this assessment, the management or the treatment guidelines have to be, basically they rely upon this assessment. So this is very important to assess the patient correctly. And then the differential diagnosis. Of course, this condition, this bipolarity is sometimes due to the genetic predisposition, and it can sometimes be there due to the medications, due to the debilitating conditions that the person is suffering from. Substance misuse, for example, alcohol and cannabis indica are the substances that can be found out when you when you dig out from the history, the personal information, the drug history, the medical and the surgical history, the past history. All of these will give you a plan of action how to manage a particular case. So the course and outcome that we've already discussed is again very important, and we'll have the mild depressive symptoms that are usually very common. The average person with bipolar disorders will be euthymic 50% of the time in his day or in his week. He'll be euthymic. Euthymic is basically a state in which he's normal. So this euthymia has to be observed, and we don't always find the person in a state of depression and in a state of mania. The person will give you a history that he's usually in a normal mood 50% of the time. So this is very important, and the manic or the hypomanic for 10% of the time. So depressed varying severity is 40%. The phase of depression is basically prevailing when we're talking about the bipolar affective disorders. It is more of the depression, and sometimes he get manic or hypomanic. So upon the diagnosis is sometimes quite wrongly made when you say that it is an isolated depression. It's not usually the case, and sometimes it is a phase of the bipolar affective disorders. We have to keep this in our mind while making the diagnosis. The factors associated that are with the poor outcome are the long time spent depression. A person will go into a severe depressive phase if the depression is untreated in such individuals. And then the psychotic symptoms, they sometimes prevail in a particular patient. The phase of mania is in basically, it indulges into the phase of psychosm. That is, the psychotic phases are seen in a lot of individuals if it is left untreated. Then there is an early onset that has to be looked for. The alcohol and drug use, as I've already emphasizing on the fact that the history taking is very important to get the correct and the detailed history, to get the parallel history from the friends and the close relatives. It's again very important when you are making the diagnosis to get the correct history of the substance misuse over here. The poorer social support systems, of course, this bipolar affective disorders are seen in countries, in the developed countries, in which the social systems, in the support systems, the family systems are not quite commonly seen in such individuals. Then the low socioeconomic status also gives you a risk factor. And if you belong to this low socioeconomic group, you are at risk of getting this bipolar affective disorder. Now, talking about the assessment, it is very important to establish the pattern in a particular patient. Whether it is a unipolar mood disorder or whether it is a bipolar mood disorder. In a unipolar disorder, of course, the person will only give the history of mania, and sometimes he'll be euthymic, and at other times he'll be in a state of mania. The interview again is very important. How to take that interview? Because to make the diagnosis, the interview is the mainstay. To take that interview out of that person, if he's in a state of mania, he'll go into aggression. So you don't want that patient to go into aggression, and the flight of thoughts. If he's in a state of mania, there will be a flight of thought and there will be a pressured speech. You won't be able to get a coherent speech out of that person. So you have to make that skills to get the correct history from the person who is in a phase of mania, and how to get that interview. It can be very difficult at times, as I've already emphasized. These skill and judgments are required. So the skills and judgments can only be polished if you do it again and again. If you practice a lot with the manic patients and with the depressive patients, you will get that particular skill and the judgment criteria that you need to get the correct diagnosis done. Then the clarifying about the history and the mental state. So it's again very important that you clarify the person that you're suffering from a problem. He won't be in a state, or he'd be in a state of denial that he doesn't have any problems at all. But he'll be in a state of grandiosity, and these delusional grandiosity state, it's very difficult to make that person come out of that state. The corroborative history is very crucial, and obviously this is taken from the friends and the family. The nature and the frequency of the episodes of depression, it's again very important over here, and we'll get a history of alcohol usage or any substance abuse if it is found in the history. The differential diagnosis over here can be the diagnosis of an elated mood, can be that it is seldom problematic, and it can be a cause of secondary mania. Urine drug screening for a substance abuse. The physical examination is done quite carefully. In adults, the differential diagnosis can be schizophrenia. It can be a schizoaffective disorder, or it can be a substance misuse. So these differential diagnoses we have to keep in mind, and we have to basically negate these diagnoses if we want to make a correct diagnosis in this particular disorder. So the bipolar diagnosis is comprehensively studied in this section. So that is the end of this section. Thank you for watching sqadia.com.